After a bone fracture, the body goes through 4 main stages to recover and regenerate bone tissue.
1. Stages of bone healing. Inflammatory phase, first 3 to 5 days. Occurs immediately after the bone is fractured. Swelling, redness, bruising, and tenderness appear due to the formation of a blood clot at the fracture site. Soft callus phase 4 days to 3 weeks. Fibroblasts in the granulation tissue begin producing collagen, forming cartilage and fibrous cartilage to fill the gap between the 2 broken ends of the bone. Hard callus phase 1 to 3 months. Mineralization occurs. Calcium and phosphate are deposited into the cartilage, helping to form a solid bony bridge at the fracture site. Remodeling phase 1 year or more. Includes 2 steps. Repairing the callus area. The bone gradually returns to its normal structure, which can take several months to years. Restoring bone shape. Children have a better ability to restore bone shape compared to adults.
2. Factors affecting bone healing. Systemic factors. Age. Younger individuals heal faster than older ones. Health conditions. People with chronic diseases such as tuberculosis, cirrhosis, diabetes, or gastrointestinal disorders may experience delayed bone healing. Pregnant and breastfeeding women also have slower bone recovery. Nutrition. Deficiencies in minerals like calcium, phosphorus, and vitamin D can slow down bone healing. Nutrients such as vitamin C, omega-3, lysine, arginine, proline, glycine, cysteine, and glutamine support bone tissue regeneration. Lysine, which the body cannot synthesize and is found in animal bone extracts, helps with calcium absorption and retention in bones. Local factors. Alignment and fixation of the fracture. When the bone ends are properly realigned and securely immobilized, the healing process proceeds more smoothly. Fracture location. Areas near the ends of bones, spongy bone, or regions with abundant muscle attachments tend to heal faster. Surgery. Surgical intervention is necessary when there is significant displacement, multiple bone fragments, or severe soft tissue damage.
The bone healing process is a complex series of biological reactions influenced by various factors, including age, health, nutrition, and how the fracture is managed. Maintaining a nutrient-rich diet, adhering to treatment protocols, and ensuring proper bone immobilization will help bones recover faster and stronger.
Don't forget to subscribe for more daily wellness tips.